Hi, doctor. How are you today?
Good, how are you?
Great, thanks. All right, could you please introduce yourself to us and tell us what you do?
My name is Dr. Vahid Rahimian and I'm a chiropractor.
All right, and is this your office, right?
Yes.
Okay, could you please give us a tour?
Sure, come on in.
Thanks.
Okay, let's start with the left side. This is my receptionist office. We usually do the paperwork here, have the folders, files. This is my treatment room / exam room. Usually the first time the patients come here, I do a neurological exam on them, orthopedic exam on them, and then we decide what we want to do with the patients.
Perfect.
The next room is mainly the therapy room. This room, I bring the patients usually in their second or third visits, and I use this table to adjust them, and it does a perfect job. With this table, I can adjust them any way I want.
Great. Your office looks pretty big and very
Thanks.
bright.
In this side of the office, we have a small therapy room / exercise room. Usually, I designed this area just for the PT stuff, physical therapy stuff, and mainly athletes.
But it's not finished yet, right?
No, not yet. It's half done, and I'm planning to add more stuff to the walls. You're gonna see later. In this room, I mainly do physical therapy stuff. As you can see, this is the machine to do the physical therapy, muscle stimulation, electrical stimulations. And here I have the vibra cursor, usually to vibrate the different muscle groups. And then this machine is usually for adjusting using electrical instruments.
Oh, what is this for?
This machine is usually used for the massage. You know, I can massage the muscles to relax them before an adjustment. And it's called vibration or vibration therapy, and the company is right here.
Very cool.
And I also have hot packs to relax the muscles.
Nice.
Many different stuff to relax. Okay, this room is my favorite room. This is where I do the traction, usually for the patients that are candidates for surgery. You know, I can bring them here, consult with them, and if I can help them, this is a great alternative for their pain and usually the disc problems, such as sequestered discs or herniated ones.
Very nice, very nice.
And it does both the neck traction and the low back traction.
And is there any way that you can demonstrate
Sure, I can demonstrate it. Do you want it now or later?
After the tour is over.
Okay, sure.
Perfect.
Sure, I'll do it.
Please, thank you.
Okay, this is my office. It's not ready yet, but it's almost done.
Oh, very cool.
Yeah, this is where
What is this?
This is a gift from a special friend that gave it to me. This is from Iran.
Oh, yeah.
And it's called khatam. Basically, it's handmade, and they make it.
Oh, it's handmade?
It's handmade, yes.
Like every single piece of
Every single piece of it,
Wow.
yes. And this is, yeah, this is a place where I bring my patients, usually after the first visit, to talk to them, talk about their problems and how can I help them and how much usually it's gonna cost them. And
let me see here.
yeah, you don't have to show those.
These are very nice. I'm sure you work hard for these.
Thanks.
So you graduated from UTD, right? UT Dallas?
Yes, I got my bachelor in biology from University of Texas in Dallas, and after that I went to Parker College. Back then it was called Parker College of Chiropractic, but they changed the name to Parker University now, so it's been known by Parker University.
Very nice, very cool.
Yes.
All right.
And at the end of the office, I'm gonna get an X-ray. So this is the X-ray room, and that's the bathroom, and that's the break room. I don't know if you want a tour of that. But
All right, thanks, doctor, for the tour. Now,
you're welcome.
Please. Okay, now what we're gonna do now?
Now we're gonna take Madi to the traction room, and I'm gonna demonstrate the cervical traction on him. He's been suffering from neck pain for a very long time, and I'm gonna traction his neck. So come on in, Madi. Okay, so as you see, this patient is lied down on the table, and I'm going to strap this unit around his neck, which we call cervical areas in chiropractic, and I'm going to traction his neck for about 15 minutes and see how it's gonna feel. Okay, just go down a little bit. Does it feel comfortable?
Are you looking for any?
Yes, I'm looking for basically these two bones at the end of the head, which are called mastoid processes, and I'm going to level it with this machine. So when he's gonna traction, it's gonna traction basically from the root of his head, and it's not gonna push the muscles down, so he's gonna feel pain. Okay, I'm gonna tighten it up. Does it feel comfortable? Okay, then I'm gonna put this strap on his head, tighten it up. Okay. So basically I'm going to do the treatment time for 15 minutes. And what this machine does, it's basically it starts from a very low weight, usually around 5 pounds, and it's gonna go to the maximum which I choose for the patient. In his case, I'm gonna start with 15 pounds for today because his neck is not used to very large amount of traction. 15 pounds. The minimum is about 3 pounds. Okay.
Madi, please tell us, how do you feel whenever it's pulling your neck?
Okay.
Thanks.
You're welcome.
Okay.
How much does the machine cost? The whole bit?
This machine usually costs anywhere from $7,000 to $9,000, and as I said, it's a very good alternative to surgery, and the patients with sequestered discs and bulging discs usually come to our office to get this treatment done, and the treatment averages anywhere from $40 to $60, which is a very small fraction to the amount you want to pay for the surgery. Okay, so we're gonna start, and I'm going to give you this. Whenever you feel nauseated or any pain that you can't handle, just push the red button.
Oh, so is it the stop button?
Yes, that's the stop button for the patient. It's basically an automatic mechanism, so if the patient doesn't feel comfortable, he can just push on it and stop the machine. Usually, it's used when I'm not here, but if I'm with the patient, you know, he's safe. I can just hit the stop button here.
So it's already pulling?
Yes. It's starting from very small poundage. It's about 3 pounds, and it's gonna go up.
Do you feel anything?
Not yet.
Not yet. So your neck is stronger than 3 pounds, huh?
Yeah, as I said, I usually start with a higher pound, but in his case, since it's his first time, I'm gonna use with a smaller.
You saved down, sorry.
Yes.
What is that for?
This is basically for bringing the table up and down.
Oh,
you can, yeah, you can change the height of it. And I don't want to go to the details, but usually when you want to do C1, C2, you need to be in a higher level. And for the lower cervicals, you bring the table more down. So that's why it's used for. And the same thing for the lumbars. If you want to focus on L1, L2, or L4, L5, you need to change the height of the table.
I see. So how much pound it's pulling right now?
Right now it's pulling 5 pounds. As I said, it has different steps, and in his case I put the steps at 6, So it's gonna start with 3 pounds, go all the way to 5, 6, go to 9, go to 12, go to 15, and then hold that 15 and then bring him back again, gradually.
So it says 5 pounds in 13 minutes?
Yes, 13 minutes remaining, 5 pounds of traction. And as you see, it's on the second step and it's gonna go to the third.
Oh, for the...
Yes.
Done 8 pounds.
Now, yeah, now it's pulling 8 pounds.
So do you feel anything now?
Not yet. A little bit more.
Maybe I need to change it to 30.
On the table. Yeah. You put that pressure on 80. See what happens.
It's gonna be hit.
That'd be nice. Good friend.
Yeah, the nice thing about this type of traction is that it's controlled. The machine usually does the traction, so it controls the amount of force which is applied to the neck. We have another types of tractions too, which we can do manually, but I prefer this method because basically just, you know, it's safer.
So how do you do it manually? You grab a neck?
With manual treatment, yes. We have different manual treatments. You can do it with a towel, or you can do it with the special straps, which again we put it under the mastoid and we push the head back. But I usually don't do it for patients like him because he already has the problem. But as far as the wellness patients, I usually do it on them. Usually the basketball players, football players, which get a lot of amount of force on their neck. I'm just gonna pull it out and it's gonna feel great for them. They love it.
Feels good now.
Oh, it feels good? So right now we're
10 pounds.
10 pounds.
Yes.
So why are you saying it feels good? It feels good. I mean, what's it doing to you? Stretching your neck?
Stretching it, yep.
And I'm getting jealous.
Yeah, that's what the patients feel usually is the stretching of the muscles, but in reality, it's the disc spaces that are getting open. When you look at that chart, I usually show that chart to my patients. When you see all these nerves coming right and left of the brain stem, you see all, yes, all the yellow nerves going right and left. You see that? Yeah. When you pull the bones in a very controlled manner, it's going to open up the disc spaces between them.
Oh.
And what it does, it brings the water and minerals back to the disc, and it's going to open up those nerves. So
it makes it feel good?
It makes it feel good, and it makes the disc from further damaging. It's going to stop the disc from more damage.
So if a person doesn't have any problem, they still can come here and like prevent them from getting any worse?
Sure, yeah. Chiropractic care is basically a variety of cares. It's wellness care, it can be sport injury care, it can be accident cases. So as far as chiropractic, it has a variety of different aspects that people go to a chiropractor for. For example, in his case, he had an accident before. That's why he's on this table. And as I said, if you're healthy and you feel healthy, you still need to get that adjustment done
to stay healthy.
To stay healthy, exactly. The problem with US and the population here usually is that they don't care until they're sick. And sickness and pain should not be a motivation for you to see a specialist in any areas. That's why chiropractors, we all believe in wellness care, we believe in nutrition, we believe in good exercise. And we think that with the chiropractic care, and when the nerves are working 100%, you won't get sick. That's the premise of chiropractic.
Oh, interesting. I didn't know that.
Yeah.
So right now we're at 15 pounds, right?
Yes, that's the maximum pound
So how are you feeling?
it's gonna pull on him.
It's stretching it for sure.
So it feels better now?
Yeah.
You feel those discs getting separated?
Mm-hmm.
You feel the nerves getting loose?
It's letting off a little bit.
Yeah.
It's gonna stop again.
Yeah, this machine works with the muscles. So basically, it's not going to let the muscles relax. It's gonna pull the muscle and relax the muscle at the same time, so the muscles don't know what to expect. Usually the muscles get tightened when you're scared of something. For example, in an accident case, the muscles are gonna be so tight before somebody hit you. If you see them in the rear mirror or in front of you, your muscles are gonna be tense. That's why usually the patients have so much pain after the accident, because their muscles are tight and then they get hit by a car and a lot of pain.
So it's better to get hit without you knowing first, right?
Exactly. Yeah, it's much better without knowing. That's true.
Out of the blue, someone just hits you right.
It's much better than saying
you out, you don't even know what happened.
Exactly, yeah.
Perfect.
Yeah.
Okay, Dr. Wolf, thank you so much for showing us your office.
You're very welcome.
Tour, and thanks for Mr. Marty to being a nice patient.
You're welcome.
And handling the pain.
It's a pleasure.
It's pain / pleasure.
All right, do you have any last word for us?
No, thanks for coming here.
Recommendation or anything?
My only recommendation to you guys is to stay healthy and appreciate your health, because once you lose it, you know what you've lost. So that's very, very important, to stay healthy and not get sick. And being sick doesn't mean that you just have to feel pain or anything like that. You just have to maintain your optimum health.
Right. Well, thank you so much for having us.
Thanks a lot.
Your time.
Thanks.
And appreciate it.
Thank you.
Bye.
Bye.